Yeah. Yeah, I work for the Fred Hollows Foundation and the Indigenous Australia program, and the foundation, as we call it, have a vision in a world which people are needlessly blind and Indigenous Australians exercise their right to good health. And part of our work in the Indigenous Australia program is we work with a range of partners, and Aboriginal community controlled services and their peak organisations and the Commonwealth and Northern Territory governments, and through the Indigenous Australia program also working with the local Indigenous communities and governments to improve eye health. Personally interested as well too, being an Aboriginal man and been working in the men's health for a while as well too, so that's some of my background, but within Indigenous Australia program it's also one of our areas that we focus on to, one of the domains that we work in with our program development and in developing programs for eye health. Well, I guess where I've worked around Australia, it's really different. I've worked in Perth and Sydney and in the Northern Territory, so it seems to it varies a little bit, but I particularly find in the Northern Territory English as a second language is very high, and also working in remote communities where I did in the health services, a lot of young Aboriginal men don't really access health services, so they're one of the difficult to access populations, and I guess we don't really have their voice shaping some of our programs. So I do see this program is very important to help shape some of the work that we are doing in health. And for policy and practice, I guess to make any changes you need evidence, and evidence-based practice is how we work as well too. So to address health issues, I think we do need the voice of those young men to input into those policies, because I think if we're not having their voices, well, I think it means governments are developing services for them without their voice, and we're not really addressing the barriers. And I think particularly in today's society, a lot of issues, young men are not necessarily accessing service, but what are they saying? It'd be good to get input, and what can we change in policies from their voice?
Hi, I'm Jason Bonson. I work for the Northern Territory Department of Health in the Strategy, Policy and Planning Division, and I have carried the male health portfolio for over 10 years within the department. One of the main barriers that we find when engaging with young Aboriginal men is being able to communicate with them. Talking and reading is well known that Aboriginal people have lower literacy skills. I'm hoping that this project will help direct us in how our approach to working with and engaging with Aboriginal people, specifically Aboriginal men. Communicating with Aboriginal people is key. We have this two-way learning concept. It's important that we get to hear and see the lens that Aboriginal people look at the health sector. Whether it's orally or visualisation, we don't get it right all the time, and I think there's a lot of improvement can be made. Well, apparently I'm very optimistic. What I would like to see is that this research project, along with others, will be able to influence how policy and strategies are written, and it may lead to that health can be written in Aboriginal language for us health professionals, so we get to understand it coming back to us.